Fenfluramine is a phenethylamine that is structurally similar to serotonin. Due to its ability to increase extracellular serotonin levels, modulate serotonergic and other neurologic receptors, and control neurotransmission, it is effective in treating pharmacoresistant seizures. In this video, let's find found. What is fenfluramine? What is fenfluramine used for? Contraindication. What are the side effects of taking fenfluramine? How does fenfluramine work? How to use fenfluramine? What is fenfluramine? Fenfluramine, sold under the brand name Fintepla, is a serotonergic medication used for the treatment of seizures associated with Dravet syndrome and Lennox-Gastaut syndrome. It was formerly used as an appetite suppressant in the treatment of obesity, but was discontinued for this use due to cardiovascular toxicity before being repurposed for new indications. Fenfluramine was used for weight loss both alone under the brand name Pondimin and in combination with phentermine. In the 1990s, fenfluramine came to be associated with cardiovascular toxicity, and because of this, was withdrawn from the United States market in 1997. What is fenfluramine used for? Fenfluramine is indicated for the treatment of seizures associated with Dravet syndrome and Lennox-Gastaut syndrome in patients aged 2 years and older. What is fenfluramine? Fenfluramine, sold under the brand name Fintepla, is a serotonergic medication used for the treatment of seizures associated with Dravet syndrome and Lennox-Gastaut syndrome. It was formerly used as an appetite suppressant in the treatment of obesity, but was discontinued for this use due to cardiovascular toxicity before being repurposed for new indications. Fenfluramine was used for weight loss both alone under the brand name Pondimin and in combination with phentermine. In the 1990s, fenfluramine came to be associated with cardiovascular toxicity, and because of this, was withdrawn from the United States market in 1997. Side effects. Side effects of fenfluramine in people treated for seizures include decreased appetite, somnolence, sedation, lethargy, diarrhea, constipation, abnormal echocardiogram, fatigue, malaise, asthenia, ataxia, balance disorder, gait disturbance, increased blood pressure, drooling, excessive salivation, fever, upper respiratory tract infection, vomiting, appetite loss, weight loss, falls, and status epilepticus. Pharmacodynamic. Fenfluramine increases extracellular serotonin levels, and also acts as both a serotonergic 5-HT2 receptor agonist and sigma-1 receptor antagonist. These activities, through an incompletely understood mechanism, lead to anti-epileptiform activity and therapeutic benefit. This modulation has other effects such as decreased appetite, weight loss, sedation, lethargy, increased blood pressure, and mood alteration including possible suicidal ideation. There is a risk of glaucoma and potentially fatal serotonin syndrome. Fenfluramine should be gradually withdrawn following treatment alteration or cessation. Mechanism of action. Although the exact mechanism by which stimulation/inhibition of various receptors leads to the observed therapeutic benefit is unclear, it is hypothesized to be twofold. Stimulation of 5-HT1D and 5-HT2C may result in increased GABAergic neurotransmission, while sigma-1 receptor antagonism may help to modulate responses to N-methyl-D-aspartate, NMDA. Pharmacodynamic. Fenfluramine increases extracellular serotonin levels, and also acts as both a serotonergic 5-HT2 receptor agonist and sigma-1 receptor antagonist. These activities, through an incompletely understood mechanism, lead to anti-epileptiform activity and therapeutic benefit. This modulation has other effects such as decreased appetite, weight loss, sedation, lethargy, increased blood pressure, and mood alteration including possible suicidal ideation. There is a risk of glaucoma and potentially fatal serotonin syndrome. Fenfluramine should be gradually withdrawn following treatment alteration or cessation. Dose. Seizures. Indicated for treatment of seizures associated with Dravet syndrome or Lennox-Gastaut syndrome. Without concomitant stiripentol. Initial dose, 0.1 mg per kilogram, PO/bid, not to exceed 26 mg per day. May be used weekly based on efficacy and tolerability. On day 7, may increase dose up to 0.2 mg per kilogram (PO/bid), maximum of 26 mg per day. On day 14, may increase dose up to 0.35 mg per kilogram (PO/bid), maximum of 26 mg per day. Patients who require rapid titration may increase dose every 4 days, with concomitant stiripentol and clobazam. Initial dose, 0.1 mg per kilogram (PO/bid), not to exceed 17 mg per day. May be increased weekly based on efficacy and tolerability. On day 7, may increase dose up to 0.15 mg per kilogram (PO/bid), maximum of 17 mg per day. On day 14, may increase dose up to 0.2 mg per kilogram (PO/bid), maximum of 17 mg per day. Pharmacodynamic. Fenfluramine increases extracellular serotonin levels, and also acts as both a serotonergic 5-HT2 receptor agonist and sigma-1 receptor antagonist. These activities, through an incompletely understood mechanism, lead to anti-epileptiform activity and therapeutic benefit. This modulation has other effects such as decreased appetite, weight loss, sedation, lethargy, increased blood pressure, and mood alteration, including possible suicidal ideation. There is a risk of glaucoma and potentially fatal serotonin syndrome. Fenfluramine should be gradually withdrawn following treatment alteration or cessation. That's all the information about fenfluramine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.